While there's no cure yet for this disease, there are steps to take to slow its progression. Hi, I'm Rebecca Brayton and welcome to WatchMojo.com, and today we'll be learning more about the progression and treatments of Alzheimer's from the Alzheimer's Society of Montreal. How does Alzheimer's affect a person suffering from it and his or her family?
The impact of Alzheimer's disease for the patient is usually in the early stage when you still realize what's happening to you. Fortunately, for the patient, many of them don't realize what's happening. It's called anosognosia, lack of awareness or lack of insight. In a way, it's merciful for them, because those who have too much insight, it is really, really anxiogenic. For the family, the burden actually increases over time in the moderate to severe stage, because the one you love now you have to take care of as a child, and all the souvenirs of your past life slowly get erased to the point where the spouse doesn't know who the other person is and they don't recognize the house they live in.
What about treatment?
The current treatment of Alzheimer's disease involves a good diagnosis, education to the patient and family. This requires, of course, the Alzheimer's Society and other community support groups. Treatment of depression when present, both for the patient and the caregiver. And there are specific drugs available as regular prescriptions that improve your brain ability to focus. So we call them memory medicines, but they actually do more than that. They help stabilize progression even of behavioral symptoms.
What kind of progress has been made recently in terms of understanding this illness?
We had high hopes over the past 5 years that preventing the buildup of amyloid in the brain could stop progression of symptoms in people who already have mild Alzheimer type dementia. It didn't work so far. So either we treat these patients too late, maybe we should aim for a milder stage of the Alzheimer disease, or we're aiming at the wrong target. That is, amyloid is not the main cause of symptoms. So the strategies are shifting now worldwide to treating earlier with these drugs, or to start thinking of alternative hypotheses. What else besides amyloid is important, such as a change in the cell structure called tau, the internal skeleton of the cell, or maybe trying to find a way for the brain to heal itself with some natural growth factors.
On average, how long does Alzheimer's last?
If you start at the early dementia stage, Alzheimer's disease usually run a course over 8 to 12 years. In older people, it's usually other conditions that will end life, such as a fall and injury or pneumonia. In younger people, before age 60, Alzheimer's disease can be more malignant.
Thank you very much.
It was a pleasure.